Good evening. My name is Najmeh Khalili-Mahani. It's a long name. You may call me Nash. And I study screens and stress. Since 20 years ago, when I graduated as an electrical engineer and when cellular phones had entered our lives, I've been asking, are these technologies positive extensions of us or are they harmful to our body and mind? My background is in stress neuroscience and I'm also a biomedical engineer. Biomedical engineers make tools to extend the bodies that need them. And I design information and communication technologies that promote emotional health and social well-being of those who suffer chronic pain and stress. Successful designers and innovators aspire to create indispensable technologies that extend our senses, our sense of control. And this is why revolutionary technologies such as the internet, cell phones, social networks, or things like artificial intelligence that are entering our lives can become addictive. But is this addiction good or bad? Of course, these are not new questions. In 1960s, Marshall McLuhan urged us to understand any new media as physicians would go about understanding stressed and diseased bodies. New media technologies extend our body, they touch our eyes, our ears, and also our nervous system. McLuhan drew attention to the medical research of Hans Selye, the father of stress science in the 60s. And of course, that is where the field of neuroscience was born. Selye had shown that any local injury or psychological threat would trigger a generalized stress response in the entire body. We now know the hormone for stress is called cortisol. McLuhan argued that new media amputated and replaced existing organs for communication with faster and more powerful machines. Now, when you replace an organ, the site of the transplant would become initially numb, but every transplant is a physical and psychological stressor. It causes discomfort and inflammation everywhere until the body gets used to it or dies from it. Now, today, like you, I have been grappling with this Zoom transplant. Of course, it's opening my home to you. You're welcome. But our bodies are confined to these screens, and it's not a comfortable interaction. So, are these new screen realities stressful to our bodies, or is there a silver lining? Last year, we asked 650 adults to characterize the link between their screen addiction and their stress. Interestingly, those who depended on their screens for socialization, entertainment, and relaxation were more likely to call themselves addicted to screens. In contrast, those who were dependent on their screens, and even more so for work or information, did not call themselves screen addicted. Now, behavioral addiction is bad because it skews our motivation. It moves us away from goals or norms that keep us physically and socially healthy. We become concerned about these when behavioral addictions create obsessive habits that risk our personal or socioeconomic well-being. But if we are worried about health, then should we be concerned about addiction to screens for work or information too? And what if addiction to screens for entertainment or social networking or games help us cope with stress? Isn't coping with anxiety and depression while playing a computer game safer than depending on psychoactive drugs? And what if being glued to a screen for work or school is going to be hurting our bodies? Right now, we really don't know, but we should find out. In April 2020, we had an unprecedented opportunity to ask a simple question in a short survey. Does COVID-19 stress increase our screen dependency? Not surprising, dependence on teleconferencing was up by almost 80%, and now 1,000 respondents have taken this survey. But the majority of respondents picked streaming services such as Netflix as a primary coping tool in their survival kit. Similar to previous survey that we did, those who experience higher stress were also more dependent on social networks and passive media for entertainment. Social media mattered for providing connections and community. Games and movies mattered for distraction. Many of the high stress respondents in this survey were wary of false and sensational news, but they avoided or ignored it. Now, how do our bodies adapt and adjust to these new electronic transplants? Before the pandemic, we were awakening from the numbness of our screen addiction. But now we need them to earn a living, to get educated, and to be connected like we are right now. They are the anesthetics that get us through COVID-19 stress as well. Going back to the laws of media proposed by McLuhan, Marshall and Eric McLuhan, they suggested that when confronted with a new media technology, we must ask 4 questions. 1, what are they extending? What are they killing? And what are they reviving? And most importantly, what is going to happen when pushed to the extreme? And probably the question that we should be asking ourselves in this a new screen-dependent age of COVID is what that extreme is going to be. Thank you for your attention.